Reveal is an open-source digital platform that assists managers to plan for and deliver health services equitably using the power of geospatial data. Reveal supports an end-to-end workflow to ensure planning and delivery reach the last mile. In the first step, Reveal Geo enables the macro and microplanning process through its intervention planning module. Through the planning module, managers are able to create queries which prioritize health services to specific areas. For example, focusing malaria services to populations and households located in areas of high malaria burden and are also feasible for services to be delivered. Once a plan is finalized, these plans can be shared digitally or in paper-based form to local and national managers responsible for health service delivery. Alternatively, these plans can also be shared to health field teams' mobile phones as shared in Step 2. Teams can navigate and deliver health services through the Reveal mobile app, which is accessible on the Google Play Store. Through the Reveal mobile app, each field team member can visualize all households or target areas and navigate to the specific households or areas to deliver health services to these precise locations. The mobile app tasks field teams to carry out the planned deployment by guiding them to targeted villages and households against which intervention data is recorded and monitored in real time to ensure all targeted structures are reached. Online dashboards allow program managers to accurately understand progress against the plan and coverage at village level, to understand whether services have been deployed equitably, and to realign field activities if necessary, ensuring no one is missed. Applying Reveal has resulted in remarkable progress in routine service delivery and health campaigns, including an increase in intervention coverage by 20 to 30%, a reduction in disease incidence by 15%, and a reduced cost per disease case averted by 63%. The opportunity to expand these wins to other countries and health interventions is prime. Here we will walk through the use of the Reveal microplanning features, where a program manager has access to digital maps of their country, including granular maps showing the location of households or settlements which have been derived from satellite imagery. With this information, managers are able to visualize the data and apply filters to determine the high-priority areas to target with the human resources and commodities available. Imagine a district in the country of Zambia is planning to deploy a malaria campaign including indoor residual spray or IRS, which is the spraying of insecticide at household level as well as the provision of malaria bed nets at household level. Managers have determined to focus these malaria interventions to areas reporting highest malaria burden and also where IRS is most feasible, particularly given the access challenges in the rainy season. Let's get into the web interface. Here, healthcare providers will identify areas and populations that are most in need of the IRS intervention. First, let's log in. Here, add username and password and click Sign In to open the welcome page. Let's have a quick tour of the menus. Under Admin, we can add users, upload locations, and the geographic hierarchy. We can also assign how data are tagged throughout the system. We have already imported various data to help guide the planning process, including local disease burden and historic intervention data. The program can choose what data to be included. Reveal also supports integration to central data systems through its API. Let's now begin the planning process. Building on our illustrative example in Zambia, the district of Luanshya within Copperbelt province has been allocated only enough resources to conduct IRS in 10,000 structures. The Luanshya Malaria Program Manager is now trying to determine where to prioritize these resources to achieve the highest impact efficiently. The program has determined 3 criteria they will use to guide targeting are 1. Areas of high population, 2. Malaria incidence, and 3. Whether high coverage was achieved in previous years, indicating that the areas are reachable and sprayable. We will add the first query, population. We scroll down and select or search here. Recall that the program only has enough resources to spray a portion of the total structures in the district. We need to query by population, incidence, and historic IRS coverage to narrow down from total structures of over 62,000 to the 10,000 structures which will be achievable this year. Let's see how many structures fall within health facility catchments with populations greater than 9,000. The results of the query are displayed geospatially and in a tabular grid. Here we see that 7 catchments in this area have populations greater than 9,000. We click Proceed to see where these catchments are located, and can also see that the total number of structures is just over 16,000, shown here in the stats box. The district only has resources to spray 10,000 structures this season, so we need to continue to simulate scenarios. Let's try adding a second and third variable of interest. Areas where historic IRS has been below 20% and areas where malaria incidence has been reported as high. By doing so, we can see now that only 5 catchments meet this criteria, and when we visualize these on the map, we can see that these areas include 9,816 structures, mostly along the road. The stats show that in this scenario, if we spray all structures in these 5 catchments, we will protect a population of 12,351 people. Other functionality exists within the microplanning interface, for example, the opportunity to build heat maps and overlay other data types, and visualize different layers within the mapping interface. Managers can use these types of queries to simulate scenarios, test various criteria for targeting campaigns, and use the tool to encourage data-driven decision-making during the microplanning process. Through this type of planning and simulation process, the output maps can facilitate communication between healthcare providers, policymakers, and community members of how best to prioritize and plan health campaigns. This can help to build consensus around interventions, identify areas of agreement and disagreement, and ensure that everyone is working towards the same goals. From here, if a program is choosing to use the Reveal app to navigate to the intervention targets set during the planning stage, we will link the plan to the mobile client, shown in the next demo. The program can also choose to export the microplan for dissemination or for printing to paper-based maps. You've now walked through the microplanning interface of Reveal. If you would like to learn how the mobile app and web dashboards work, please progress to the next training video.